Triumph focuses on young people aged 10 to 24. Obviously, their lives were disrupted in many ways. The impacts were different for different populations. So we can't look at young people as a whole and say it's been the same for everyone, because absolutely we know that's not the case. And we know that for many young people who may be living in more disadvantaged circumstances, the impacts have been far greater and will continue to be so. So some of the work that we've been doing in Triumph has tried to kind of tease that out, I suppose, the differential impact on different groups within the population. And we've always had a focus on some of the groups that we know are at higher risk of mental health problems, so LGBT plus young people, and also care experienced young people. So we've got different strands of work really looking at how we can best support those young people with their mental health and well-being. And obviously in lockdown there's been particular impacts for them, which it's really important to recognise and try and address.
And I think it's really important to note as well that those impacts haven't been kind of the same across the whole period of the pandemic, that those impacts have changed at different points, and that the experiences that young people had in the second lockdown were very different to the experiences that they had in the first lockdown, but also that there are kind of different impacts as we move out of the pandemic now.